Thank you for choosing me and our team for your shoulder replacement surgery at either Franciscan Hospital or OrthoIndy Surgical Center. This guide is intended to answer common questions and set appropriate expectations both before and after surgery, as well as information about the surgery itself. Please note that individual risk and outcomes are variable, so this guide is intended to set the average range of expectations, but please be aware that variations are always possible. Usually the first series of questions is regarding the hospital stay, recovery timeframe, and aftercare for planning purposes. The surgery itself is typically outpatient, which means you arrive and discharge home the same day. You will receive physical therapy and recovery, where you'll be given guidance on navigating steps, a walker, and other activities. Some patients will stay overnight either for medical monitoring or for rehabilitation purposes. To go home the same or next day, we recommend a spouse, friend, or family stay with you 24/7 for 3 days minimum, and preferably 1 to 2 weeks, depending on your baseline functional status and anticipated needs. Inpatient rehab or skilled nursing at a nursing home, as well as home health care, is an option facilitated by the case management team after surgery at the Franciscan Hospital, but this is the exception offered to individuals who live alone or have assistance needs due to advanced age or medical comorbidities. As mentioned, home health care can also be arranged twice a week for the first 2 weeks and is usually facilitated by the Franciscan case management team after surgery for those who may have difficulty getting rides or live long ways from physical therapy. On average, initial recovery is the first 2 weeks where you will be utilizing a sling, and you're only removing it to eat and arrange the elbow periodically throughout the day. You will avoid driving. You'll be taking pain medication as needed for these 2 weeks. Most people are 90% recovered and range of motion within approximately 3 months, maximizing strength and range of motion within 6 months. Most patients will be able to reach higher than shoulder level, reach behind their head, but range of motion typically is not 100% overhead or behind your back. Physical therapy is prescribed 1 time prior to surgery for prehab exercises and expectations, and twice weekly for 12 to 16 weeks postoperatively by default. The physical therapist discharges you when rehab goals have been met. Return to work is generally 3 weeks for an office job, 6 weeks for a medium activity job, and 3 months for a highly physical occupation such as working in maintenance or construction. Long-term restrictions are no lifting over 25 pounds overhead or 40 pounds floor to waist. Typically, we prescribe a pain medication, anti-inflammatory, muscle relaxer, aspirin, stool softener, and in some cases, an antibiotic to manage your pain and risk factors with surgery for the first 30 days. Icing for 20 minutes every several hours the first 1 to 2 weeks is very helpful. Place a cloth or other material between the ice and your skin to avoid ice burn. Some people choose to purchase or rent an ice pack sleeve or cooling machine, and Amazon online provides some great options in this regard. Note that you can shower immediately with the surgical dressing on, comes off in 1 to 2 weeks, and continue showering, but no submersion in a tub or pool for the first 6 weeks after surgery. Now that we've covered the most pertinent questions for planning and mental preparation for surgery, let's cover the procedure itself, risk and benefits. A total shoulder replacement can be in the form of an anatomic, as in this case, the bone socket is in the anatomic orientation, or a reverse shoulder replacement, which is utilized for rotator cuff tear as well as arthritis in the joint, as indicated here where the bone socket orientation is opposite. The components in either orientation are a metal alloy with polyethylene liner for articulation. I utilize a CT-based guide in surgery, where the guides order preoperatively for precise alignment of your components. The risk of this surgery includes infection, bleeding, blood clots, of course scar and stiffness, swelling, fracture, implant loosening or failure, dislocation, numbness and nerve pain, neurovascular injury, and in extremely rare cases, loss of life or limb from heart, vascular, or blood clot complications. A few details to be aware of in planning for your surgery. You'll want to avoid dental work for at least 3 weeks prior to surgery or 3 months after your surgery. Take care of any outstanding dental problems prior to surgery. When you return to your dentist postoperatively, please have them prescribe amoxicillin 2 grams or clindamycin 300 milligrams, and take this 1 hour prior to cleanings or procedures for the first year after surgery to prevent joint infections. If you have immune compromise or significant medical problems like diabetes, you may choose to pre-medicate with antibiotics for the rest of your life when you get dental performed. You will get pre-testing labs, usually through the clinic prior to surgery, to screen for medical problems affecting surgery or anesthesia. If you see a heart doctor, please let us know, as we will need to facilitate cardiac clearance prior to surgery for anesthesia purposes. Surgery staff will typically have you washed with chlorhexidine the morning of and potentially the night before surgery to reduce skin bacteria and lower the risk of infection. Nutrition is a very important aspect of recovering to give your body the optimal tools to support immune health and wound healing. We recommend to drink plenty of fluids the day before surgery and also in recovery to maintain hydration. You'll be fasting, of course, after midnight before surgery. Eat plenty of protein from fresh food sources such as eggs, lean meats, fish, tofu, nuts, seeds, beans, and dairy. To avoid constipation, stay hydrated. Drink coconut water or prune juice. And if you haven't had a bowel movement, or at least passed gas for the first 2 or 3 days after surgery, consider over-the-counter milk of magnesia or other products that your local pharmacy can provide to get your bowels moving. Pain is quite variable throughout the time frame of recovery and also from person to person. Although we do provide a variety of medications to help with your pain, note that you should still expect to have some level of pain, and our goal is to simply take off the edge of the pain to make it tolerable. Activities long-term involves no lifting over 25 pounds overhead or 40 pounds floor to waist, no reaching out to the side past neutral for the first 6 weeks. Otherwise, progressive activities gradually is tolerated after the first 2 weeks. Long-term, most patients can return not only to normal daily activities, but even recreational sports within moderation. Thank you very much for your time and attention to this video. Hopefully this will help you prepare and allow for a successful recovery.